So as discussed, we'll be going over some of the NCLEX most tested topics, and in today's video we're just going to be talking about all the systems you would likely see on the NCLEX. Like I said before, we used to do this in a group, and I have a couple of friends testing very soon. So I thought I use this opportunity to bring it out here so we can all do this together. I'm just going to quickly check if everyone can hear and see me. Let me see. Um, can everyone hear me? Can everyone hear me? Oh yeah. So now, so even if you're not here now and you join us while we go through all these NCLEX most tested topics, just in case you miss any of them, try as much as you can to go back and watch. If you have questions, you can always draw me back or let me know. Florence. All right. And also at the end of this video, I'm going to put all the PDF files of. Honey, can you please control Florence? At the end of this video, I will try to put in all the PDF files of the systems we've gone through on the description for you to download or put it on your phone or do whatever with it. So like I said, we're just going to go over all the systems we need for the NCLEX. So this is like a summary of almost all the systems you need to master for the NCLEX review. Hi, welcome, and thank you so much for joining. So the core priorities for the NCLEX is, the first thing is for you to always assess the patient's level of consciousness. That is the very first thing you need to do. So as a nurse, you get a scenario, you get a question. The very first thing that comes to your mind is to assess this patient. Then you now can go ahead and look into airway, breathing, and circulation. So you always assess patient first before calling the code, before calling for help, as for you to have a baseline of what you're looking at, what you're working with. Now, if a patient is hypotensive, the major thing we are looking at to help this blood pressure come up is to give fluid, right? So you always have to think of the first thing you should always do as a nurse. Now, under cardiovascular stroke peripheral vascular system, we have a couple of topics we will be looking into while I walk you through all the systems you need to master for your NCLEX prep. Under cardiovascular, we have hypertension, hypotension, shock, heart failure, myocardial infarction, arrhythmias, cardiac arrest, peripheral vascular diseases, DVT, and cardiac medication. So the most important thing I want to talk about here is, once you start studying for the NCLEX, you have to keep in mind that you need to master the medical condition, connect it to what is going on in the patient's body, which organ is it affecting, and what medication would likely go for this patient. Once you have these three things in mind, you'll be able to like have your way when you're doing the actual examination. And another thing I always like to tell people is when you start studying for the only this thing is actually like I can't even hear myself. So, what I like to tell people is when you start studying one particular system, try as much as you can to go over the questions that has to do with that system. It helps you kind of retain what you've studied. So, for example, if you do respiratory and you have the question bank, you go to the question bank and do the respiratory questions. I hope this helps someone. If you're just joining, this live section is on YouTube. That is where we'll be having most of the live sections. I'm not sure if I can put in a PDF file of this material on Facebook, but if it is possible, I would likely put these materials down. So now for cardiovascular, like I said, we have hypertension, hypotension, shock heart failure, myocardial infarction, arrhythmias, cardiac arrest, peripheral vascular diseases, DVT, and cardiac medication. So you know the condition, you know what is going on with this patient, you master the organ where it's actually um, happening, and then the medication. So like with these three, I think you'll be able to like have a clear understanding of what the question is talking about. Okay, now for respiratory, we have asthma, COPD, pneumonia, tuberculosis, pulmonary embolism, ventilator management, oxygen therapy, and chest tubes. So these are like I just try to like compress like the most tested topics that you really need to know. Because like sometimes most people find it difficult to like read through all the textbooks like Saunders. Some people think it's too much. So if you don't have time, and another thing, I also like got a 6 week and 12 week study plan, and I'm also going to put it on the description of this video. I will also try as much as I can to send out to people that would like actually reach out to me for some of these resources. And every day once we finish any live section, I will put in the PDF of each live section on the description box. So, like I said, for respiratory, we have asthma, COPD, pneumonia, tuberculosis, pulmonary embolism, ventilator management, oxygen therapy, and chest tubes. Then for neurology, we have stroke, seizures, epilepsy, increased intracranial pressure, head injury, spinal cord injury, meningitis, and encephalitis. Um, for musculoskeletal, we have fracture, CAS, traction, osteoporosis, osteoarthritis, rheumatoid arthritis, amputation, and mobility. That's range of motion. And for GI, we have Crohn's disease, ulcerative colitis, constipation, diarrhea, bowel obstruction. I hold on. This is my first time of trying to use StreamYard in a long time. So I'm actually finding most of the settings very difficult. But let's see how it goes for today. Okay, so for GI, we have GERD, we have Crohn's disease, we have ulcerative colitis, hepatitis, cirrhosis, pancreatitis, constipation, diarrhea, bowel obstruction, and peritoneal nutrition. Um, Also for GU, we have UTI, pyelonephritis, renal failure, dialysis, nephrotic syndrome, glomerular nephritis, and kidney stones. So for today, we're just like trying to go over all the topics, and I'm actually going to try as much as I can to give out like most of the tips I used that worked for me. Now, for immune system, we have HIV, autoimmune disorders like lupus and rheumatoid arthritis. We also have allergic reactions, anaphylaxis, and immunization under immune system. Under endocrine, we have diabetes mellitus, type 1, 2, um, diabetic ketoacidosis, um, hyperthyroidism, Addison's disease, Cushing syndrome, SIADH, and diabetes insipidus. I hope you all can see my screen here. Now for hematology and oncology, most of the topics you would likely see can include anemia, iron deficiency, or sickle cell, leukemia, bleeding disorders, cancer care, chemotherapy precautions, and all that. So, for reproductive and sexual health, we have menstrual disorders, endometriosis, um, contraceptives, STIs, male and female reproductive cancers. And there's one thing I like to always talk about. Sometimes you may not really get questions from all the systems, but it's good you try as much as you can to cover as much as you can, because the way the NCLEX is designed, you don't even know where your question is coming from. And you could get questions from reproductive, you could get reproductive health, you could get questions from cardiac or neuro, depending. Most people get more, like I think I got more questions on pharmacology. And the thing is, if you don't even prepare yourself very well, you're going to like lose yourself at some point. Okay. So now for infectious diseases, we have sepsis, MRSA, tuberculosis. This is where we will go through and talk about standard precautions, contact, droplets, and airborne precautions, where to use them, how to use them, and what to don and how to doff. Now, for visual and auditory, we have cataract, glaucoma, retinal detachment, macular degeneration, hearing loss, otitis media, and Meniere's disease. For integumentary, we have pressure ulcers, burns, wound healing, okay, skin infections, dermatitis, and for pediatrics, we have growth and developmental milestones, congenital heart defects, respiratory, so I think it's divided into adult and pediatrics, because um, most pediatric conditions are kind of different from the adult ones. So for pediatric, like I said, we have growth and developmental milestones, we have congenital heart defects, we have respiratory conditions that can include croup, RSV, and asthma. For kids, we have gastrointestinal, we have pyloric stenosis and intussusception. Infectious diseases for kids, we have measles, mumps, and varicella, and pediatric pain. This is very important, because we need to, most times these children, they don't know how to, they can't even express if they're actually feeling pain or not. So we need to master the skill of which you we can be able to like recognize, is this patient as a child having pain, how bad is this pain for this child, and what we need to do as nurses for this child. Now for maternity, we have antepartum. For high risk pregnancy, we need to know the complications. For example, preeclampsia and gestational diabetes. It's our duty as nurses to educate most of these women on the things they need to do after getting care from us. Interpartum can include labor and delivery, fetal heart rate monitoring. You need to know how to um, monitor the NST. Most in most facilities, the most responsible healthcare provider is responsible for reading the NST. But as a registered nurse, to an extent, you also need to have an in-depth knowledge of what is going on with your patient. Postpartum, we monitor hemorrhage, infection, and mood disorders for new moms. For newborns, we look at the ABGA score, newborn reflexes, and other conditions affecting newborns, which we will also review during the process. And also, pharmacology is like the most important. Like I said earlier, when you're studying the NCLEX, you need to like know the disease condition, what organ is this disease condition affecting, and um, you should be able to connect it to the medication you need to give to this patient. So, condition, organ that is being affected, and management. All right. So for pharmacology, we have medication, safety, high alert drugs, antibiotics, antihypertensives, diuretics, insulin, oral hypoglycemics, psychotropic medications, and pain management. Pain medications like opioids and non-steroidal anti-inflammatory drugs. For mental health, we have anxiety disorder, depression, bipolar disorder, schizophrenia, substance use disorders, suicidal precautions, and crisis intervention. Then for critical care, we have shock, which can include hypovolemic, cardiogenic, and septic, multi-organ dysfunction, mechanical ventilation, and cold response. So, as a registered nurse, especially here in Canada, if you are on the floor, if you are in the emergency unit and something happens, it's on you. It's your responsibility to like to an extent know what to do, because most times the healthcare providers may not be in some of the facilities. So what are you going to do as a nurse if there is a code? You need to like master some of the basic things, the first things you need to do as a registered nurse. So that's why code blue is under critical care. Now for renal system, we have acute kidney injury, chronic kidney disease, dialysis, which can include hemodialysis and peritoneal dialysis. Please, if you have any question, feel free to draw me back. Although I'm still trying to master this system I'm using, because it's my first time of actually using it in a long time. Okay, so I think we are almost done. For renal, we have acute kidney injury, chronic kidney disease, dialysis, which includes hemodialysis, peritoneal dialysis, and electrolyte imbalances. So these are almost all the topics in all the systems that you likely see in the actual examination. So once you're able to like go through all the systems, um, the medical condition, what is going on with this patient, the first thing you need to do as a nurse if it's an emergency, and the medications. I think you're halfway, or should I say, let's just say 60% ready for your examination. Then the next step is for you to be able to study and do your questions. So if you do a system, try as much as you can to go back to your question bank, even if it's 10 questions, 20 questions. I know sometimes it's not easy, but try to like do a question, because if you like do cardiac, do respiratory, you're not doing the questions. When you come back to the questions, you may likely forget like what you read on that system. So it's the trick is for you to do the reading and go back and review the questions. So I hope this information um, help someone out there. I actually work full time. So most time, the only time I'm able to come up for the review, it's when I'm off. So when we start along the line, even if I'm off for like 2, 3 days, I hope you guys will be able to bear with me. I have a lot of my friends and colleagues joining us from all around the world. I am grateful for your support. And like I said, if you have any question, feel free to draw me back and we'll always tackle those questions together. I will also be putting up some questions like questions for the questions of the day. If you have any question like on any system you're finding difficult, I know a lot of people are finding pharmacology and um, cardiac arrhythmias quite difficult, which they are going to be one of the first we are going to be discussing during this review. So, like I said, feel free to let me know or draw me back whenever you need my attention. So, we're going to call it a day. For everyone that joined on YouTube and Facebook, thank you so much for joining. Okay, like there is one more thing here, but that's just like a life-threatening condition anyways. We're still going to talk about it when we dive into the actual lesson. So this is just the NCLEX review master summary of all the systems we are likely going to see on the NCLEX. Thank you so much for joining, guys. Bye now. Yeah, yeah, I'm making a video. You were disturbing me. Okay.